Would you encourage the member states, particularly China, to allow Taiwan to attend as an observer this year? And conversely, I understand that you have the authority to invite them yourself. Would you do that if China continues to resist their participation? Thank you.
Thank you very much, Lucas. And I apologize that I did not introduce our guest, our fourth speaker here. It's Mr. Derek Walton, who is a legal counsel of WHO. He is here with us, and I think he would like to take this question.
Thank you very much. And yes, of course, we have the World Health Assembly coming up on the 18th and 19th of May. This year it will be held virtually, and it will be a de minimis session, which means it will focus principally on the COVID-19 pandemic. The involvement, if any, of observers from Taiwan, China in that assembly is a question for the 194 members of WHO, the member governments. It's their decision. And indeed, a proposal has already been made, as it has been in recent years, for this matter to be considered by the Health Assembly itself. And that is a question which is properly for the member states. But whether or not Taiwanese observers participate in the Health Assembly, there are well-established arrangements for health experts from Taiwan, China, to work with WHO on technical health matters. And I think we've already explained in some detail at previous briefings how that's worked. That last year, for example, Taiwanese experts were included at 8 expert meetings, and that there were 6 other informal technical meetings. And this year, there have been contacts in response to COVID-19 involving Taiwanese experts in key groups and networks. I think we've given details of that on previous occasions. But for this year, as I say, the question is for the Health Assembly. It's for the member states rather than the Secretariat to decide that question. Thank you.
Thank you very much, Mr. Walton, for this explanation. Next question is for Savio Rodriguez from Goa Chronicle. Savio?
Hi, can you hear me?
Yes.
Okay. My question goes out to Dr. Tedros. On January 14th, WHO stated preliminary investigations conducted by the Chinese authorities have found no clear evidence of human-to-human transmission of the novel coronavirus identified in Wuhan, China. As an independent global health organization, why did WHO have to rely on China's preliminary investigations into the human-to-human transmission possibility of the coronavirus and not conduct one of its own investigations, is my question.
Thank you.
So I can start, and perhaps others would like to supplement. So the 14th statement that you're referring to is a tweet in which there was the reporting of what had been reported to us from Chinese authorities. I think what is critical and what is important is how WHO acted from the moment we heard about this cluster of atypical pneumonia from Chinese colleagues in Wuhan. From the beginning, I'm the MERS specialist, the focal point at the organization. Mike led the SARS response. And so from the start, whenever you hear of a cluster of an atypical pneumonia, you think respiratory and you think human-to-human transmission. It's not if, it's just what is the extent of human-to-human transmission that may be happening. Within hours of that notification that was picked up through our EIOS system, we activated our emergency systems at the 3 level of the organization, which means our headquarters, our regional office, and our country office in China, where we were having discussions about what we knew, what questions needed to be asked. We immediately posed questions to our colleagues in China to ask for more information, as we do with all clusters or all alerts or all signals that we pick up through the electronic monitoring systems. From the beginning, we assumed that there would be human-to-human transmission. And in our first reporting to our member states and contact points on the 5th of January, it's in our EIS, which is Event Information System. We included detailed information about the cluster itself and also about protecting against acute respiratory infections. We also published on that day our first disease outbreak news. From there, we worked with our international partners to develop guidance, which is around how do you find cases, how do you protect healthcare workers, how do you treat patients, and all of those guidance materials were guidance materials that we adapted from our MERS guidance materials, which included information about how to protect for human-to-human transmission because these viruses are transmitted by respiratory droplets in contact. So our first guidance that was issued was on the 10th of January, which included information about how to protect against human-to-human transmission. So that's important. I did a press conference on the 14th where I did this with Tarek, I described what we knew, and at the time there were 41 confirmed cases. The novel coronavirus had been identified, PCR assays were available in China, and they confirmed that 41 out of the initial more than 100 suspect patients actually had this now we call COVID-19. But at the time we were calling it a novel coronavirus. And so in those 41 cases described that there may
It's
be
22
human-to-human
hours.
transmission, mainly among close contacts. It's very important that you understand that we receive information from our member states, but we also go back and ask lots of questions. We always do this. It's not unique to this particular situation or unique to China. And we base our actions on what we know and what our experience is with other similar pathogens, other similar situations. From the beginning, we expected that there could be human-to-human transmission. It was just a matter of how much was actually occurring, where was it occurring. And so initially we thought it would be amongst close contacts through respiratory droplets, and that is still the case today.
Thank you very much.
Just one thing to supplement to in terms of maybe explaining to people the incident command system at WHO. We operate under a very well-documented emergency response framework, which is an organization-wide framework for managing emergencies. It is constantly under review. And in the process of epidemic or emergency intelligence gathering, we can get up to 3,000 signals a week sometimes that require follow-up. And what we're constantly doing is sifting through the various epidemic signals. We use our own expert networks to do that, seeking information from countries. The systems have AI components for looking for unusual events and picking them out of the background noise. For many outbreaks that occur, we would generally wait for some level of confirmation of the disease before triggering our incident management system for that specific event. We follow every event, but for certain events we trigger the IMS. The IMS is a special mechanism that creates a special and dedicated multidisciplinary team across the 3 levels of the organisation and ensures that that event gets a dedicated response for the amount of time it needs to bring the event to an end and to support our member states in that response. That incident management system was established for this event without a diagnosis of the disease, without the virus being known, on the 1st of January. And that IMS has remained in place every single day and has operated as one entity across the 3 levels of the organisation since that day.
So just 1 minute. I think it has been covered properly, but wanted to clarify one aspect. The rule we have in WHO and other UN agencies is when a member state reports, we post the member state report as is. So what we did on January 14 in the Twitter is we posted China's report as is. That doesn't mean that we agree or we disagree. We're just reporting what came. Sir, where are you from? The person who asked the question? From India. So if India